Now let's take a closer look at the standard operating procedure for keeping the room and its content sterile. Sterilize the room for at least 30 minutes using a sterilizer lamp. Ensure the entire room is in a sterile condition and the floor must be mopped with Lysol. All equipment to be used must be sprayed with 70% alcohol. The patient, doctor, and nurse must wear disposable surgical gowns. If working alone, prepare the hair that has already been inserted into the needle 1 day in advance and place them in the sterilizer or dry sterilization so they are ready for immediate use during the procedure. And here are some key points to note. During implantation, ensure that the spacing between each hair is not too close or crowded. If implanted too densely, it increases the risk of forming sebum buildup, dirt accumulation, and dead skin cell congestion, which can lead to cysts or pustules. For clients with no eyebrow hair or completely bald brows, implant as minimally as possible. It is better to create a sparse, natural look rather than placing hairs too close together or giving a voluminous effect. Ideally, use 50 to 80 strands per eyebrow, with a maximum of 200 strands for both eyebrows. Be more selective in choosing suitable clients for this procedure. Conduct a skin test using a skin analyzer beforehand to determine whether the client is a good candidate for the procedure. Remind and inform clients that this is a semi-permanent cosmetic procedure, meaning the implanted hairs will not last permanently. Regular maintenance is required, such as retouching when hairs start to fall out and consistently maintaining eyebrow hygiene to prevent clogged pores. It is important to maintain room cleanliness as this procedure more likely hair plantation operation and ensure all tools are properly sterilized before performing the procedure. As this procedure can take a considerable amount of time, if the client needs to use the restroom during the session, all treated areas must be covered with povidone iodine and wrapped properly to prevent exposure to bacteria. Please keep in mind a consultation session is required before the procedure to discuss some important details as follows. Communicate with the client regarding their requests, desired eyebrow shape, density level, color, and type of hair strands. Explain risks and possible complications. Discuss the entire process, including expectations and realistic outcomes. Inform about the number of sessions required. Do not provide guarantees or promises. Explain post-treatment care and ensure the client agrees to follow it. Clarify the costs involved. Always exercise discretion when selecting clients, accepting only those suitable as customers. Before starting the procedure, let's go through the essential setup preparations as follows. 70 isopropyl alcohol swabs. Anesthesia, a betadine solution container to hold betadine. Fiber brows or real human hair, depending on the client's request. Sterile gauze, tweezers. Surgical marker or purple pen. Antiseptic spray for skin. Sterile disposable gloves or surgical gloves. Sanitizer spray for equipment. Floxa eye drops. Cotton buds. Trash bin. And a sterile and clean workspace. Before the real fiber brows procedure, identify and mark the veins in the eyebrow area using a vein viewer device. This step is crucial to ensure that the hair insertion does not puncture or interfere with any major blood vessels. In the event that a major blood vessel is punctured during the procedure, any hair strands implanted in that area must be carefully extracted and re-implanted in a new area to avoid complications. Let's go over a few important notes for using anesthetic tools. For ethical reasons, we're not displaying the details of anesthetic prescriptions here. You should have already received the full prescription details by email. But if you haven't received it yet, feel free to contact us and we'll send it to you right away while keeping everything confidential. Let's take a look at the complete fiber brows cloning procedure from start to finish. First, clean the eyebrow area using alcohol. And then wipe the brows with povidone iodine for antiseptic preparation. Map the eyebrows using thread, then cover the eyes with sterile gauze. Apply anesthesia using an injector device. Identify and mark the veins in the eyebrow area using a vein viewer device. Begin the procedure. During the procedure, cleanse any blood residue with wound spray. Then remove dried blood from needle punctures using ofloxacin. If active bleeding occurs during the process, stop it using a cotton bud soaked in povidone iodine. At the final stage of the procedure, spray skin shield protection. Lastly, apply healing gel to the treated area. And here are the cleaning standard operating procedures for client maintenance visits to the clinic. First, clean the eyebrow area with micellar water, and then apply anesthetic cream and leave it on for 30 minutes. Remove the anesthetic, then use an antibacterial high-frequency device covered with gauze at low speed, adjusted to the skin condition. Any hair that have become too deformed are removed. Moisten cotton pads with maintenance liquid deep cleanser until wet. Place them on both eyebrows and apply Vapozone or warm steam for 10 minutes. If the pores appear clogged, clean them using a skin scrubber and an Una spoon. Replace damaged hair with new ones. However, they are not inserted in the exact same spot but slightly next to it. Finally, clean off the mask residue with povidone iodine, wipe with an alcohol swab, apply ofloxacin drops, and apply healing gel. If the client prefers not to have the cleansing treatment done at the clinic, they can also do it at home. Just make sure it's done regularly, ideally once every 2 weeks or at least once a month, by following these treatment steps. Use the high-frequency device at a low speed to kill acne-causing bacteria. Avoid using high speed as it can burn the hair. Soak a cotton pad with maintenance liquid deep cleanser, place it on the eyebrows, and apply warm steam Vapozone for about 10 minutes. And after 10 minutes, use an ultrasonic scrubber. For sensitive, acne-prone, and oily skin, it is recommended to use a needle size of 32 gauge by 1/2 inch or 13 millimeters. The gift box provided for the client contains 1 bottle of NaCl 500 milliliters to clean the eyebrows for 1 month, 1/2 box of sterile gauze, 10 to 20 pieces alcohol swabs, 1 bottle of skin shield protection, 1 bottle of antiseptic skin spray, 1 bottle of ofloxacin, 1 jar of healing gel, and 1 piece of brow heater. As post-procedure instructions, the client should take antibiotic medication, which is amoxicillin, for 1 week after the procedure. Once the client is at home, they must avoid seafood, spicy food, and heavy sweating from exercise. The client must be followed up for about 2 weeks. Starting from day 1, you can ask, did you sleep well last night? Do you feel dizzy? Is there any swelling, pain, itching? And it is important to inform the client not to touch or press their eyebrows. The amount of hair used can differ for each client based on their unique condition. For eyebrows that are sparse or completely hairless, hair usage is approximately 200 to 400 strands for both eyebrows. For thin eyebrows, hair usage varies depending on the desired eyebrow density. Around 130 to 180 strands are used for a sparse, natural look, while 180 to 300 strands are used for a fuller, more voluminous result. For eyebrows that are incomplete or missing the tail section, hair usage is approximately 80 to 120 strands for both eyebrows. And to fill in gaps, scars on the eyebrows, or areas affected by a brow lift, approximately 50 to 100 hair strands are used. Please keep in mind that the durability or lifespan of the hair ranges from 1 to 3 years or longer, with recommended touch-up sessions every 3 to 6 months to maintain optimal appearance. Now let's find out how to use the brow heater. Please be aware that both sides of the silicone brush can be used as needed. Lift the front part of the eyebrow hairs upward and hold for a few seconds. Bend the tip of the hair downward in a half-circle shape and hold for 10 to 15 seconds. Repeat until the desired result is achieved. In this section, we'll look at the brow heater usage guidelines, which are differentiated based on temperature recommendations and duration of use. Turn the brow heater on by pressing and holding the power button for a few seconds until the blue light turns on at level 1 or 65 degrees Celsius, and wait until the black silicone brush changes color to white. Once it has completely turned white, the device is ready to use. Initial months, 1 to 3 months. If brow hairs begin to change shape, it is recommended to start using the brow heater at a low temperature of 65 degrees Celsius, which is indicated by the level 1 button. Long-term use after 6 months. If the brow hairs still do not respond to 75 degrees Celsius, which is indicated by the level 2 button, after 6 months, you may increase the temperature up to 85 degrees Celsius, which is indicated by the level 3 button, following strict observation and time control. Here are some important notes to keep in mind. Act early. If brow hairs start to change shape, immediate correction using the brow heater is necessary. Always start with low heat to avoid damaging the hair. Avoid delay. If you wait too long to fix misaligned or misshapen brow hairs, they may become harder to realign with the brow heater. Avoid overuse. Do not use the brow heater too frequently, as excessive heat application can damage the silk protein layer of the brow hairs, causing dryness, brittleness, or breakage. If you encounter a case complication from a procedure done elsewhere, you'll need to follow the standard operating procedure as follows. Clean the eyebrow area with micellar water and alcohol swab. Apply anesthetic cream and leave it on for 30 minutes. Remove the anesthetic cream, then use a low-speed, high-frequency antibacterial device adjusted to the skin condition. Remove all the implanted eyebrow hairs. Moisten cotton pads with maintenance liquid deep cleanser until wet. Place them on both eyebrows and apply Vapozone or warm steam for 10 minutes. First 5 minutes, keep the eyebrows covered with the wet cotton pads. Next 5 minutes, remove the cotton pads and let the skin absorb the steam directly. Cleanse the area using a scrubber and an Una spoon. Apply a soothing mask on the eyebrow, skin, for example, containing tea tree or chamomile, then use photodynamic therapy lamp for 10 minutes. Finally, clean off the mask residue with povidone iodine, wipe with an alcohol swab, and apply healing gel. The eyebrows are now fully sterilized. If the client wants to have the procedure done with us, their eyebrows must be fully healed. The healing process takes approximately 3 months before we can proceed.